it so much you may even get tired of winning.
Are you expecting a recession this year?
I hate to predict things like that. There is a period of transition. It takes a little time.
Welcome to Is It Bad for the Economy, the podcast where we explore whether Trump's economic policies are helping, hurting, or just a load of hot air. Happy New Year. My name's Kobi Tirey. I'm a Democratic media consultant trying to figure out how the Democrats can finally get the credit they deserve for outperforming Republicans on the economy for essentially my entire lifetime. And I'm joined by the anonymous, the fantastic financial practitioner, Banker Bill, who's doing some fantastic work at a bank you've definitely heard of. It's Sunday, January 4th. We're sorry we skipped a week. It's the first week we've skipped since we launched last year, which we're very proud of, but we appreciate the patience. Please, please, please keep sharing this podcast. Keep sending us those reviews. We're so thrilled that this podcast has grown so much, but we definitely need to keep it growing as much as possible to improve the economic discourse that's happening in this country the way that only Banker Bill can. Today, we're going to be talking about insurance. A lot of you probably saw your health insurance premiums go up as these Obamacare subsidies lapsed. But first, we've got a lot of news to catch up on. And the biggest thing, of course, is the invasion of Venezuela, the attack on Venezuela, the kidnapping, the arrest of Venezuelan President Nicolas Maduro, whatever you want to call it, whatever we're going to end up calling it this week. You can probably guess how I feel about this topic. But for this podcast, I do really want to just briefly touch on the economic side of things. All in, Afghanistan was about $2 trillion, Iraq somewhere between $2 and $3 trillion. And I simply cannot believe that this Venezuela project is going to be significantly cheaper, because now that there's a power vacuum there, we have to figure out some way of propping them up in order to keep our own interests, our own country safe. Trump says he's going to pay for it with oil. We've heard it before. We heard it from Trump on the wall that Mexico would pay for it. That wasn't true. We heard it about Iraq from George W. Bush. That wasn't true. It wasn't even true for Libya when Obama went and toppled Gaddafi. We never ever see the oil money from these things, and we shouldn't, because that oil belongs to those countries, and we probably shouldn't be in those countries in the first place. A lot of discussion about the quality of Venezuelan oil. Folks forget Venezuela, not only the number one proven oil reserves in the world, they were also the founders of OPEC. A lot of people associate that with the Saudis. It was actually Venezuela. And if you're a Boston Red Sox fan like I am, the legacy of Venezuelan oil is alive and well right there at Fenway Park with that giant Citgo sign.
Number two heating oil. Good stuff for the Northeast.
So look, this is a long story. We're going to be covering it for a long time. Banker Bill, do you agree with me here? Do you see any way in which we can make money off of this thing, if we even should?
I don't have much of an opinion. Assuming a rollback of sanctions, supposed current state of infrastructure, extraction, refining, terminaling, break-even price on Venezuelan crude could be anywhere from $50 to $80 a barrel. Last year, crude traded between, let's say, $55 to $81 a barrel. Yeah, that's about all I have to say on that. I have very low conviction. Current oil prices have been in the mid-50s over the last month or so. American producers need at least that price to break even themselves. And much of the loss of Venezuelan production over the last decade came at the expense of American production. So what I'm saying is, as Venezuelan production fell over the last 10 years from the Maduro government, American shale production more than offset that reduction in capacity globally. So their loss was basically our gain. So the economics of it, very hard to describe or even know. And I would just say anyone who does say that they know, they don't.
Reuters interviewed an energy and geopolitical strategist named Thomas O'Donnell. He basically said it's going to be 5 to 7 years before we see any sort of payoff. Banker Bill, we are hearing a lot, though, about these refinery plants in the Gulf, and that the United States decades ago set itself up for not energy extraction, but to refine this very crude, very dirty foreign oil that they get both from Canada and from South America. Is there a cheat code here where we already have the infrastructure to maximize profit, or is the price of oil just so low that whether you're going to make money on this is a question of where the market is that day?
In the past, refining has been where the money's been. Not so much anymore. In fact, over the last 5 to 7 years, we've actually been closing refineries. We've probably closed at least 5 since the pandemic. Many reasons for that: lack of demand, transition to cleaner fuels, et cetera. But even the refineries that we have left today in the U.S., those are operating at 90% plus of capacity. So this isn't a situation where you could just take Venezuelan crude, extract it from the ground, put it on a boat, and refine it in American refineries. There's no plug and play. We don't really have the capacity to do that. And that's public information. You could just go look that up. If you did want to build a new refinery, well, 2 to 5 years to do that on a need it yesterday project timeline. I don't know. I'm very low conviction on this. The oil is easy to discuss. The economic minerals are easy to discuss. There's myriad reasons for this. I mean, it should be mentioned that Maduro wasn't even the duly elected president of Venezuela. The person is this guy, who is it, Gonzalez, who's actually living in exile in Spain. So many moving parts.
One minor economic wrinkle that actually came up in our November episode with Wall Street Journal trade reporter Gavin Bade was that somebody bet $30,000 just before the attack that Maduro was going to fall that day. They apparently made $400,000 off of that bet. Are we just doomed to see this insider trading as long as we allow companies like Kalshi to operate, or is there any way that we're going to actually prosecute folks for insider trading on this stuff?
I have no idea, but I was very interested to see that this occurred, having Gavin spoke about it a month or so prior. This person took 4 positions. 2 of them really paid out. So one bet or one position they took paid out 14x. The other position they took paid out almost 9x. It was a new account, so very clear. Somebody knew something and traded in front of it. Is that illegal? I don't even know. Is that insider trading? I couldn't tell you. They took a position in an open market. I mean, what even are these Kalshi markets? Who regulates them at all? Are they regulated by the SEC? I actually couldn't tell you. I mean, it seems just like a free-for-all. Who even knows who did it? Who knew what when? What if this was like some Venezuelan lieutenant in the army who sniffed something out and placed these? I mean, you have no idea who it could have been. Remarkable that this can take place. You can now take positions on acts of war.
Some people were joking that it was President Trump. Obviously, there's no evidence for that. But now the fact that anybody in our national security infrastructure, anybody at the State Department and the diplomacy corps, anybody up and down the chain can make a quick buck just by essentially leaking this information to a gambling market. This isn't an economic issue anymore. This is a national security concern.
Yeah, I would agree. I mean, what know your customer controls are in place for Kalshi, like they are for a bank, for them to even transact on the platform? If the FBI comes knocking and says, who was that? Does Kalshi even know?
The other issue that came up recently that we first talked about with Gavin was the pasta tariff. Trump backed off. He said that the pasta companies were making good on their promises not to dump, and he reduced those tariffs. So, the tariff isn't gone away forever, but it's mostly gone, which was right in line with what you and Gavin predicted. As you know, I've been tracking the effective tariff rate just by taking tariff revenue that came in divided by the total value of all the goods that came in for that month. We finally got the November numbers, 8.8%. The tariffs are now down to 8.8%, even lower than that 10% benchmark that we said had been priced in from the beginning. And yet inflation continues to be sticky. It is unbelievable to me that we can now definitively say tariffs are not creating inflation. It's the threat of tariffs that are creating what might be the final bump in the inflation story to get us back down to that 2% target.
Yeah, maybe. I'd add back to the pasta. They were threatening 92%. The tariffs are now going to be somewhere between 2 and 14%. But that's still on top of an existing 15% tariff on all EU imports, which was enacted last year. So that still sticks. Then the kitchen cabinet, vanity, wood furniture tariffs that they announced in September, they have pulled those back in their entirety. So yes, I think you make a point that the uncertainty of tariffs is maybe even greater than the actual effective tariff rate. But look, over the last year, the effective tariff rate has basically been about 10%, where it was about 2%. So this is a 5x in terms of an increase on the effective tariff rate of imported goods. And you've got these people walking around here as if they've done us a favor.
Unfortunately, the biggest economic issue that's affecting most Americans' pocketbooks, probably most of the listeners listening to this, are how much health insurance premiums, how much Obama healthcare exchange premiums have gone up since Republicans let the healthcare subsidies lapse, despite the historic shutdown that we saw last fall, and despite the shutdown that's right around the corner at the end of January.
So you think we're going to get one again?
Look, I'm not nearly as confident as I was when you asked me this question about the last shutdown. That one I thought was a done deal. I do think that there is some hope that Democrats and Republicans get a deal done. There's something special happening in Congress right now. now with the discharge petitions. We've never seen a Congress that's this willing to cross the aisle in order to screw over the speaker and get something done. They broke the record for the number of discharge petitions. Obviously, it all started with Epstein. They've kept it going with a bunch of other stuff. The Senate shut them down, which is why you haven't really heard about it. But I absolutely do think that we're seeing potentially a defrosting of the hyperpartisanship that we've seen in Congress for so long. We are seeing a lot of negotiations. We are seeing a lot of people talking that we historically wouldn't see wheeling and dealing, at least not in recent memory. That being said, is there a concrete deal getting done somewhere that is getting ready to get turned into a bill that's going to pass here in the next 3 weeks? That seems like a very tall order. So I think more likely than not that we have a shutdown. But no, I haven't given up hope yet, just because people are talking. People are starting to consider that maybe they have more political points to score by getting something done as opposed to kowtowing to Speaker Johnson and Donald Trump.
All right. So everything you just said sounds like an improvement. Negotiations among our elected leaders is always a good thing. We're all on the same team. You predicate all of that on discharge petition. Take a minute and just define for me and everybody listening what a discharge petition is.
A discharge petition basically means if a bill has passed committee, it's been voted out of committee, the speaker then decides whether all of Congress is going to vote on the bill. And they very easily, and they very often could say, no, I'm not scheduling a vote on that. I don't want that to go into law. I'm going to enact a default veto. However, there is one remedy, and that's the discharge petition. If a majority of members of Congress, 218, get together, they can say, no, we're scheduling a vote on this, whether the speaker likes it or not. That's what Ro Khanna and Massey did with the Epstein files. But that's just to say that I do think that there's some hope, but no, I think, 60, 70% chance that we are going to have a shutdown. And the damage has already been done. So healthcare is a big topic. We don't have time to tackle the whole thing here, but I want to ask specifically about the health insurance companies. In the United States, we pay more for healthcare than any other nation across the board. We pay more at the doctors, we pay more at the hospital, we pay more for insurance, we pay more for our prescription drugs. And I would argue definitively, objectively, we are not getting better care for spending that much more money. Our life expectancy is about 4 years lower than our economic peers who are paying less per person for healthcare that's keeping them alive longer. The bad guy has become the health insurance companies. And with the health insurance premiums rising, I wanted to ask you, Banker Bill, do you think that's fair? Do you think that the health insurance companies bear a lot of the blame for the fact that these prices keep going up and up and up? And ultimately, do you think that regulating health insurance companies is the solution, or are we going to have to find a new model entirely to keep from being absolutely bogged down by healthcare prices year after year after year?
Firstly, do they bear responsibility or the blame? Sure. But I don't think they are proportionally the problem as much as the blame that they get. I think that lies more with the hospitals, physician groups, and big pharmaceutical companies. Unfortunately for the insurance companies, they bear the brunt and the reputational harm because that's who the end consumer is negotiating with. In a better system, we'd have one where the insurance companies, whether a for-profit insurer or a nonprofit health insurer, which there are some, mostly regional players, that they would be the primary advocate and representative for the insured, negotiating rates down to acceptable costs and reducing administrative burdens and hurdles that would ultimately reduce rejections of service, etc. Something that I've found that was very surprising to me recently was the denial rates in health insurance for claims is something around 10 to 20% in the United States. For auto insurance, it's like 5 to 15%. And it just seems incredible to me, a failure by the health insurance companies, that you would have a denial of claim for healthcare at a higher rate than you would for auto insurance when in an auto accident or something with that. There's myriad ways that you would think you can wiggle out of paying that claim. And yet, the denial rate for a healthcare claim for something that you ostensibly needed is much higher than it is for a car claim. And I think a lot of that is incumbent on the insurers themselves. They don't explain benefits well. They don't explain your coverage very well. They push burdens back onto you. And the handful of health insurance companies out there that do get good marks of satisfaction from their customers or their policyholders, they report satisfaction because they're easy to deal with. Low denial rates. They explain things. They're a partner. They're an advocate. Their value add is the representation, the service, and the engagement. And people get frustrated that they pay for care, and then when it comes to needing it, they don't get the level of service or level of coverage that they anticipated they'd receive. Some of that is borne by the policyholder, the person that's paying for the insurance, to know what's covered. But the system is such that it's obfuscated, and everyone involved, whether it's the insurer, the hospital, the physician group, the pharmaceutical company, they all hold a hand in obscuring information from the policyholder.
You hear these eye-popping numbers. We experienced one in this household recently where we had a very costly ER visit. You get the bill and it's in the like high four figures, low five figures for that hospital stay. And then you read the fine print and it says, never mind, it was just $1,600 because it went through the insurance. Or you talk to somebody who took that step of calling up the hospital, trying to negotiate with them after the fact, and they're able to sometimes easily, sometimes after a lot of cajoling, get a discount that's in the thousands of dollars. With healthcare prices increasing at every single stage of the healthcare industry, is the fact that the insurance companies are able to essentially collude with the doctors, with the hospitals to set rates, not to compete, but to set rates. Isn't that one of the biggest reasons why we have the highest health costs in the world? Because they're able to just say this is what it's going to be, and then the second anybody complains about it, they make one exception, and if you're the person who got the exception, great, but for the rest of us, it's just a load of nonsense where the prices keep going up and up and up.
Generally, I agree with you, but I'm coming at this from a different perspective. Here's my understanding of how this works. Hospitals maintain these master lists of procedures with varying prices, and every hospital organization has a different one. These hospital organizations are very regionalized, so they start with an off-the-street, out-of-pocket price. This is your sticker price, let's call it. If you're going to a car dealership, this is the number that you see on the door of the car, right? Then there's this discounted price that your insurer is negotiating for you as a policyholder and saying, hey, I'm Kobi Tirey Insurance. I have 150,000 people in your area here. I want to insure them. How much is a hip replacement? $10,000. Look, my members aren't paying 10 grand. We'll pay 2 grand. Okay, fine. Let's settle at 5. Deal. So now the person off the street pays 10 grand. The person insured by Kobi Tirey pays $5,000. So if you get left with this bill, you're not paying your insurer when you get the bill. You're paying the hospital, the physician group, pharmaceutical company. So if you push back on the hospital, the physician group, or the pharma company and say, hey, I don't have this money, I can't pay this, whatever the balance is, they'll often settle for a lot less than your initial bill because it's worth more to them to just settle with you than it is to send it to collections or assign a bad debt. Should it work that way? Hell no. But basically, it's like you're going in there and you go to a hospital or a doctor's office, and all these places do an incredible job of making you feel like they're in your corner and not at a used car dealership. But truthfully, that's kind of where we're at. And if they can get an extra dollar or nickel out of you, they are. It's not your insurer in that respect. The insurer has their own problems. The insurer has all these administrative costs. The insurer has denial of claims with 10 to 20% denial of claims. I think that's ridiculous. But to focus on the costs alone, I don't think that's really driven by the insurance carrier themselves. If the insurance carrier had better access to this rate information to collectively bargain on behalf of all people with insurance, right? If all these insurers were able to get together and collectively bargain with the hospitals, pharma groups, and pharmaceutical companies, the policyholders would get better rates and coverage.
I understand how that was supposed to work in theory, but in practice, I don't buy that this is a negotiation leveraging economies of scale. I was looking at a report that came out of New York State between 2010 and 2019. Healthcare prices for Medicaid went up 8%. For Medicare went up 16%. For private plans, it was up 38%. So the prices for private plans are going up much higher than the nonprofit alternatives. It makes a lot of sense why. There are almost 1 million people in this country whose day jobs are just marking up healthcare, doing the upcoding, the marketing, the billing, the denying of coverage. Private overhead is 10.3%, which is 5 times higher than the 2% overhead of Medicare and that Canada's Medicare system for all has. According to a study in the Annals of Internal Medicine, over 1/3 of the dollars Americans spend on healthcare are going to administration, twice as much as in Canada. So I understand how health insurance is supposed to work, but I don't believe that for-profit health insurance is working in this country right now. And I don't think that you can explain these 2-3-fold price increases based on normal negotiation. Those swings are just way too high, and we see them every single day.
You said in Medicare and Medicaid, it would seem to me that kind of is proof and parcel of my point that they have better negotiating leverage than private insurers, and therefore their costs have gone up at a slower pace than private insurance coverage. The second I would say is no, it is apparently not working, but this is similar to what we covered about higher education, hiding price information, subsidizing demand. And there are certain insurers, like there are certain universities, that are doing very well, provide good service, have low denial rates, and are providing good outcomes. Then there's a whole bunch of other insurers that people can't stand and they feel that they're stuck, whether that's because of their employer coverage or because it's the cheapest option and they would want better coverage, but they just can't afford it, whatever.
I think that's just far too simple of an explanation. If private insurance overhead is 5 times higher than the nonprofit alternatives in this and other countries, you can't simply explain this by larger negotiating pools. They are the bloat. The government is not the bloat and the waste here. It's the private insurance companies, and they're the only people in this process who don't need to exist.
The insurer doesn't need to.
The private for-profit insurance companies do not need to exist.
Yeah, you can make that claim. I'm not trying to go down this road, but if there was some all-payer option that would compete with private insurance, I'm not against that either. There are several nonprofit insurers, Kaiser, some of the Blue Cross Blue Shields, local insurers that are more regionalized to a state or two, and they're nonprofits with margins that are like 2, 3, 4%. People seem to be pretty happy with them. That's quasi-private. I don't see anything wrong with those. But I mean, to your point, you are right that insurers are contributing to high administrative costs. That is through fragmented negotiations, prior authorization requirements, and claims denials. How about this? The claims denial rate is 10 to 20%. Of those claims that are denied, less than 1%, according to Kaiser Family Foundation, are appealed. So with respect to the claims denials, 10 to 20% of health insurance claims in the U.S. are denied. Of those, less than 1%, according to the Kaiser Family Foundation, are appealed. Of those that are appealed, over 40% are overturned. 56% are upheld, 44% are overturned. My point is, you've got a 20% claims denial rate, and you're telling me of those people that are denied, almost half of them are actually reversed. So that to me says you have a problem in your denials.
100%. And I'm really glad where you didn't go with that plan is that the solution is for everybody to appeal their denials more. Unfortunately, you should appeal all of your denials.
You should, yes. As an individual, yes. But as a system, that's outrageous that 20% are being denied. That should be more like 5 or 10%. And it should be that low because people should know what's covered or what isn't. You shouldn't have to jump through all these different hoops. And if you cut the denial rate down, you would also cut the administrative costs that the health insurance companies are paying themselves.
One of our few Trump supporting listeners is in health tech. He's looking at starting an AI company that's going to start auto appealing all of these health insurance premiums. And that's fine and good. And I hope he makes a lot of money and helps a lot of people doing that. It infuriates me that we're going to just toss bad AI money after bad health insurance money to try and solve this problem. These health insurance companies, the private ones, they're not holding up their end of the bargain. They're not providing value. And I think the case for Medicare for all just keeps getting stronger. I don't say that because I want the private health insurance companies to go out of business. I agree with you that layering private insurance is an option that should be available to everybody. The problem is that Medicare for all is not currently legal. And if these for-profit health insurance companies had to compete for a Medicare for all, I'm sure you'd see those denial issues start to get a lot better really quickly. I think you'd start to see the overhead costs go down very quickly because they'd finally have some real competition that wasn't exploiting the fact that they essentially had the ultimate captive market.
I agree. I don't think there's enough competition. I would expect that on balance, their margins would stay close to the same, their profit margins, and their service would get better. I mean, I don't really know. This is a gap for me. Medicare for all, this or that. I've been around the world. I have friends in different places. Healthcare's come up. I have general understanding how some things are paid for. We have countries that are supposed allies of the United States who have pretty decent systems who we could easily borrow healthcare ideas from, and we just don't. That have private insurance layered with some kind of publicly available option if you're buying a car. If you don't have access to information, how do you know what you should pay for a car? If you can't check today online and look up how much the same car with these features sold for within 50 miles of my zip code, how would you know what to pay for it? For a medical procedure you need, you'll never find out how much it costs. And as a matter of fact, there are different costs for the same provider on whether you get that procedure done in a hospital or at an office park near where you live. And the office park may be more convenient to you, but may actually cost 5x. And you have no idea. And there's just some expectation that you should call your health insurer and they'll tell you. Like, no, the value add from the health insurer is supposed to be telling you, hey, it might suck that you have to get over to wherever it is for your procedure, but you're much better off going to the hospital, and here are transportation options for you to do that. And the ones that have the health insurance, that handful of ones out there that have high satisfaction scores, are doing exactly things like that. I'm not defending health insurance companies at all. I simply think that the yields or returns for reducing cost of care, which I think is the primary objective, that the efforts are better spent attacking the primary drivers of costs, which are the hospitals, the physician groups, and the pharmaceutical companies, which are 60 to 70% of the total costs. And the health insurance themselves, the role that they have to play is in covering rates, setting rate schedules in conjunction with the hospitals, physician groups, again, I keep saying that, and then also providing the value add services that you would expect from your representative.
I'm sorry for being so unfair and asking you to keep focused on the health insurance companies. That's partially a favor to editor Kobi, and because we do try to keep these as close to 30 minutes as possible. I'm sure we'll cover the biopharma companies, the hospitals, and the doctors before too long. One explanation for a long time has been that Medicaid options are driving up costs because the health insurance companies, the providers, the hospitals, et cetera, have to offset Medicaid by racking it up on the private side. But when you look at the numbers, that actually doesn't seem to be the case. I was looking at a report from the Fiscal Policy Institute, and they were citing research that said that hospitals that have a lot of Medicare patients, Medicaid patients, the private costs at those hospitals are actually lower than they are at hospitals that have a majority of private patients as opposed to Medicare and Medicaid patients.
I don't know if you have it in front of you. Is that on a total nominal dollars basis or on a per person basis? Right? Because I may be charging a lot less on a per person basis to the private insurer, but nominally they're paying more as a headline price than the Medicare Medicaid person. I don't know if that's the case. It's a possibility that I bring up. Nonetheless, these insurers, the publicly traded ones, have profit margins in the single digits, which are comparable to like a grocery store. The nonprofits that are operating in the space are about half. So nonprofit health insurers about 3 or 4% profit margin. Private equity is not out here buying up health insurers. Who are they buying? Hospitals and physician groups. Why? Because they know that's where the regulatory moat and the money is to be made. That's where the profits are most protected.
Frankly, once again, a little surprised how easy it was to get you to agree that there were some merits to the Medicare for all option, especially as a competitor to the private for-profit insurance companies. I'm a huge fan of when the private market isn't doing what you want, instead of regulating them to death, you send out a nonprofit government-backed competitor to see if you can improve performance based on competition alone.
You could pilot this though, Kobi.
Yeah.
A state like West Virginia, healthcare spending is like 30% of GDP. In Washington, it's 12%. You don't need to roll this out and make it a mandatory thing nationally. There's places where it truly is a mess. And if you just bend the costs in those places of the highest concern, you would have the most impact. And instead, we just do nothing.
One thing that's craziest to me when you're exploring this question of why is everything so expensive in the American healthcare system, everybody is miserable. The patients are miserable. The health insurance companies are miserable. The hospitals are miserable. The doctors are miserable. Everybody hates this system.
I think the hospitals love it, but go ahead.
Okay, that was going to be my question. Do you actually believe everybody that they're all miserable, or are they just passing the buck here?
I think the hospitals are probably the happiest, the pharmaceuticals second, the physicians organizations, the large private practices, and then the insurers. And I'm only saying that because I'm following the money. The insurers are the least profitable organizations in this whole thing, and they're the only ones that are ostensibly supposed to represent you.
One of my favorite political arguments for a Medicare for all option is that I really like the idea of finally walking away from the employer-based health insurance model, because how many small and medium-sized businesses were never started because somebody wasn't willing to risk giving up their health insurance? How many folks do you know who have a really great business idea, but they're never going to take it seriously because they just can't take that final risk of giving up their health insurance? You, as somebody who's much more of a diehard capitalist than I am, does that argument resonate with you?
It does resonate. I don't know how many businesses didn't start, but I know it matters a lot, even for businesses you'd consider big, like 50 people. The costs are high. There's smaller risk pooling, right? You go to a health insurer and you say, hey, I want you to negotiate on behalf of my employees. The insurer says, oh, how many you got? I got 50. Doesn't give you a whole lot of leverage, does it? I got 15. I got 10. I got 5. Right? There's high administrative costs for the business, including HR, compliance costs. And, just the cherry on top, Kobe, it sucks because there's a tax credit for this. It's called SHOP, the Small Business Health Options Program. And whenever something sucks, government seems to love to create some kind of little tax credit for you. Expensive to raise a kid? Child tax credit, whatever. I personally know two people who wanted to start a business. These people don't know each other, two different businesses, but they couldn't break away from their employer-sponsored coverage for their family. They're still at those jobs. They haven't left. It harms entrepreneurial spirit. We don't have to go chasing these broad break the system solutions when there's stuff right in front of us. There are better outcomes in Japan, Germany, Switzerland, Netherlands, all of whom use an all-payer model. Germany, at the very least, I know has a private insurance on top of that. I'm not saying it's all going to work in the United States, but it's worth trying. Our healthcare spending to GDP is 17, 18%. Theirs is 10. I would target 10. That'd be pretty good if we got to 10, 11, or 12%. That'd be excellent. That would be, you'd go from 5 trillion in healthcare spending to 3, 5.5 to 3.5. That'd be a huge win. Think about how much productivity and money you would unlock. Remember, another thing too about all this healthcare spending, it is almost exclusively on consumption. When you go for healthcare, when you meet with a doctor, that is time consumed. You can't get any of that back. That's not investment. All of that healthcare spending is consumption spending. It is no different than buying a new pair of sneakers. It is used up, and once it's used, you can't get it back.
Please invest in your physical health. But of course, economically, the point is well taken. Let's take it back real quick to what Congress can do to avoid this shutdown. Would you extend the subsidies for a year, for a couple of years, to try to negotiate a better deal down the road? Do you think that that's worth it? Or do you think we just need to bite the bullet and start from scratch?
I always thought the solution was just to pare them back and not kill them off entirely and roll them off. That's another thing the government does that pisses people off, is they make these benefits, subsidies, tax credits, deductions, whatever. So many of them are step functions. So as soon as you hit a specific dollar amount, one extra dollar, you lose the whole thing instead of incrementally rolling it off, right? And these subsidies, as I understand to begin with, were a pandemic fixture where we brought them on as a way to get through, but costs and inflation came up behind it so quickly that people are now stressed. And if you take them off, it's a political football, and that's ultimately what they did. But I always thought the simple, easy, bipartisan thing was like 2-year extension, and you roll them off or you roll them back. Instead of it up to 700% of the poverty level, it went to 500, 400, 300, or you increased the income and rolled it off. Instead, it's just, nope, cliff. For 20 million, man?
Over the summer, there were some headlines coming out that the health insurance companies are doing really poorly financially, losing stock market value, having a really bad time. Somehow those stocks all rallied in the fall, right during the shutdown. Is that a coincidence at all? Do you have any insight into that little rally there?
It could not be. But I'm a big trend guy, right? The healthcare operating margins are around 7% over the last year. The last 10 years, they're 8 to 10%. Publicly traded health insurance companies. 2 ETFs that track healthcare services, so think health insurance services related to healthcare. One is the Spider Healthcare Services Fund, ticker XHS. That's up 10% over the last 5 years. Another is the iShares U.S. Healthcare Services ETF, IHF. That's up 2.3% over the last 5 years. The broader healthcare sector-wide ETFs, which would include companies in the 2 ETFs I mentioned, those are up 30% over the last 5 years. So this is showing you over the last 5 years, the health insurers, healthcare services providers, they have significantly underperformed their own peer group, their own industry.
Well, but yeah, doesn't that make sense? They're the middlemen, they're the wheelers and dealers, they're operating at margin, whereas the biopharmaceutical companies are bringing vast new innovations to the market. The doctors are in the trenches providing life-changing services each and every day. Shouldn't the health insurance companies kind of be lagging a little behind there?
I mean, sure. Yes, that's fair. But we're talking the difference between, say, 10% of one fund and another fund is up 3 times that amount, 30%. That's a wide gap.
One explanation for that underperformance has been that the health insurance companies did a really poor job of trying to predict what the pent-up demand for healthcare would be post-pandemic and not factoring in how much prices were going to rise in general. So now we're in a situation where everybody went to the doctor, the prices went up, and now the prices went up so much that people aren't going to the doctor anymore. And hospital visits, doctor visits are down, even though profits are up for these companies. companies over the last couple of years. Are the health insurance companies to blame here at all for getting that market trend wrong? Or is that just the way it is? Companies get it right, companies get it wrong. That's a market economy.
I think you could say both. You want me to pick one because, that's the podcast. But I mean, look at healthcare equipment. It's the same story. The companies in the healthcare industry that deal in equipment, right? Making hip replacements, making prosthetics. Last 5 years, they're down 25%. The ETF that follows that. What is it? XHE. Everybody thought we're going to get all this demand. People are going to come and they're going to be buying hips and knees and everything. Nope. That's been dead money for 5 years. The companies that are making the most money, you can't invest in. It's the hospitals. It's the physician group. That's where the profits are.
Getting back to Congress for a second, let's say we get the situation stabilized. Everybody's happy, at least for the next year, maybe even going into the midterms. What's your long-term solution for this? Are you going to try to get a nonprofit competitor in there, whether it's government-backed or not? Or is there some sort of regulatory regime that can get these health insurance companies, the hospitals, the doctors all on the same page to start charging a little bit less over time?
Long-term, I'm focused on costs. We are at 17, 18% of healthcare spending to GDP. I want to get that down to about 12%, which is what it is for several peer countries with 50, 60, 70, 100 million plus people and life expectancy that aren't that far off. I think at the very least, there should be some kind of centralized claims clearinghouse for all payers of health insurance claims, that all health insurance are able to come to the clearinghouse, and what the clearinghouse does is creates a market, a buyer and seller for all of those claims, so that the denial rate goes to basically nil. Those claims that get taken up by the clearinghouse basically have to get eaten away by all parties to the care. And that would include the insurers, the physician groups, hospitals, and pharmaceutical companies, similar to the way in which FDIC insurance exists for consumer deposits, and how all banks pay insurance to the FDIC for insuring of the deposits. That would be the very least initial step. If you got more serious, I would, you asked me, so I can say whatever I want. I would leverage the health insurers to negotiate on rates for procedures. And I would eliminate the price discrimination for the same procedure at different sites. I would expect that the health insurer administrative costs, now without denials and with reductions in where care is administered, would reduce. From there, I would bring in some kind of nonprofit competing entity, not necessarily with the government backing, that would negotiate and compete against the private health insurers. I would expect then the private health insurers would maintain their own profit margins and instead focus on delivering high value add care. And if they were to do that, I'd probably be a patron of one of these private health insurers. I'd probably have a private policy, right?
As somebody in my late 30s, I'd certainly start looking at it pretty seriously.
Right. And it might be through Kaiser, Blue Cross Blue Shield, one of these local regional insurers that have high marks of satisfaction. And these ideas I have are just coming from other countries that have them.
So some sort of backstop that's making sure every claim is getting handled, some price regulation and nonprofit competition, government backed or not.
Yeah, and I feel like these are pretty simple steps. And again, I don't think you need to roll them out nationwide. You need to roll them out where it's needed the most.
Do we have a bad system, or are people ripping the American people off?
Oh, that's easy to answer. That's a bad system that facilitates and makes it easy to rip people off. And this is America, baby. If you can rip people off, a lot of people do.
We're going to win so much, you may even get tired of winning.
Are you expecting a recession this year?
I hate to predict things like that. There is a period of transition. It takes a little time